High blood pressure rarely causes pain, but it can quietly damage your heart, brain, kidneys, and blood vessels every single day. As blood moves through the artery, constant pressure pushes against its inner walls. At first, the vessel stretches and recovers with every heartbeat. Over time, persistent high blood pressure places extra strain on the artery walls, causing tiny areas of damage to develop. To repair this damage, cholesterol and other substances begin sticking to the injured areas, starting the formation of plaque. As the plaque slowly grows, the artery becomes narrower, making it harder for blood to reach the organs that depend on it. As the artery becomes narrower, the same amount of blood can no longer pass through easily. The heart must pump harder to force blood through the restricted vessel, increasing the strain with every heartbeat. Over months and years, this extra workload forces the heart muscle to grow thicker. At first it helps the heart pump, but eventually the muscle becomes stiff and less efficient. With every heartbeat, the overworked heart pushes blood into the aorta. The same high pressure now travels toward the brain, placing delicate blood vessels under constant stress. As the blood reaches the brain, years of high pressure begin weakening these delicate arteries. Tiny cracks appear in their inner lining, making them more vulnerable to blockage or rupture. If the pressure continues, a weakened brain artery can suddenly become blocked or burst. In just a few seconds, oxygen can no longer reach nearby brain cells, and a stroke begins. Without a steady supply of oxygen, brain cells begin shutting down within minutes. The affected neurons stop sending signals, making it difficult to speak, move, or even remember. This is how a stroke silently changes the brain. Although the damage begins in the brain, high blood pressure doesn't stop there. The same blood continues its journey, silently carrying this constant pressure to another vital organ, the kidneys. As the blood enters the kidneys, it passes through millions of tiny filters called nephrons. Constant high pressure begins damaging these delicate filters, making it harder for the kidneys to clean your blood. Over time, these damaged filters begin leaking important proteins into the urine while allowing harmful waste to remain in the bloodstream. The kidneys slowly lose their ability to protect your body. As more filters become damaged, the kidneys can no longer remove waste efficiently. Toxins slowly build up in the bloodstream, forcing the entire body to work under increasing stress. As the kidneys lose their filtering power, waste-filled blood continues circulating through your body. Every heartbeat now carries toxins that should have been removed, placing even greater stress on your organs. The cycle never truly ends. The heart keeps pumping against high pressure while the kidneys struggle to clean the blood. Together, this silent damage slowly weakens the entire body, often without warning. High blood pressure may stay silent for years, but every heartbeat can slowly damage your arteries, heart, brain, and kidneys. The earlier it's detected and controlled, the better chance your body has to stay healthy.